His research, his
Oh, I see.
research and teaching focus on environmental health. Jamie's topic is where does health fit in to the climate change response? It'd be great to have questions and discussion after Jamie has finished his presentation, which will be around 40 minutes, and then we'll have time for those. As I mentioned, Jamie will be probably leaving around after an hour, but we can carry on after that if depending on how we're going. Okay, over to you, Jamie.
Uh, Thanks very much, Sue. I'll just try and share my screen, see if that's working. How's that?
Yep, that's great.
All showing? Okay, fantastic. All right. Well, thank you very much for having me. Kia ora koutou. Called Jamie Hosking toku ingoa. Um, and yes, I'm a public health doctor and academic at Waipapa Taumata Rau, University of Auckland. Um, I mean, my style of medicine is public health, so I spent a bit of time working in the hospital and then realized that the sorts of things I was interested in were more about keeping people healthy to the extent that we can rather than treating them, although obviously that's important too. And I was more interested in the big picture. And I guess I've ended up with working in areas like the transport sector, environmental health and climate change. That's about as big picture as you can get. So I guess I've ended up where I'm meant to be. Um, so I'm here to sort of talk about climate change from a health perspective. Um, while I'm introducing myself and doing some whakawhanaungatanga, there's one other thing that I need to mention in terms of whānau, which is also that one of the climate declaration organizers, Pat Basket, is my mother-in-law. So if I mean, you'll have to decide for yourself whether I'm here because Pat's my mother-in-law or because I have something interesting to say. But I'll do my best.
Both are possible.
Yes, that's true. Okay, so I pointed to this journal article that was published in the blurb for this talk. It was a sort of it was an important moment in the relationship between health and climate change. Um, it signified not just that there were important health effects of climate change, because that's kind of obvious, right? Climate change is going to have huge impacts. Of course, it's going to have impacts on people's health. But the thing that it really did was signified that there was much more mainstream acceptance of that idea that climate change was something that people working in health should be paying attention to. They said that climate change is the biggest global health threat of the 21st century, not just a major issue, but a major health issue. So that was really important in 2009. And has sort of, I guess, helped to encourage a lot more work to be done to look at health impacts of climate change. Then 6 years later, there was another paper published in the Lancet, the same journal, and this one took quite a different perspective. And I want to bring this up because it's much more the sort of angle that I work in and that I'm interested in. It said that climate change could actually be the greatest opportunity for global health for the 21st century. That there are all these things we could do that would not only help to address climate change, but also improve health in a whole range of other ways. And so I'm going to spend most of this talk talking about those things. That's the sort of area that I've been working in. But I will spend a bit of time before that talking about some of the risks, the health risks of climate change as well, because that is obviously an important part of the picture, even if it's not really my focus. So here we go. It's just a few things about the health impacts of climate change. World Health Organization has done some estimates of what those health impacts might be, and it came up with this number that between 2030 and 2050, we could expect 250,000 additional deaths per year that were caused by climate change. So that's just looking at deaths. It's not looking at people being unwell in ways that doesn't kill them. And the main causes of death that it was able to count up there were these things here: malnutrition, malaria, diarrhea, and heat stress. Obviously, there are other health impacts from climate change as well, but those were the ones that that were mostly responsible for that 250,000 additional climate-related deaths per year. So that's globally. And just to give you a bit of a ballpark of how that fits in relation to other significant health risks, I've put this number of smokes deaths here related to smoking per year. So that's about 7 million. So it's quite a lot less than smoking. Of course, 250,000 extra deaths per year is something we should absolutely be trying to avoid. This is another way of looking at that information. And this is a cartogram. I don't know if people have seen this before, but it takes a map and then distorts the shape of the countries on the map according to a particular value for that country. So the top here is the emissions, greenhouse gas emissions from each country. And you can see that places like the US are really blowing up because they've got really high emissions per capita, and places like Africa really shrunk down because the emissions per capita are really low. And then the bottom here are those health impacts, those deaths that WHO had been estimating. And this is the other way around. So it's the deaths are almost all occurring in places like Africa, that are not responsible for the emissions causing this problem. So that's the sort of inequity of climate change from a health perspective. And then looking here in New Zealand in terms of the sorts of health impacts that we can expect, it's a slightly different pattern from what the priorities might be globally. Food will be impacted, of course, but it's not so much around malnutrition, more at the level of food insecurity. And the Royal Society broke this up into 8 different areas of health impacts, which I think is quite useful. So the link to the reports here if you want to know more. But they looked at some of the basic requirements for survival, I guess, the impacts on air quality, on food and water. These are all things we can't do without. Right, so it's obvious that we're going to have health impacts if these things are affected. Shelter as well, people losing their homes because of extreme weather events, for example. Um, I think the link to climate's fairly obvious, and it's the same with temperature, right? That exposure to extreme heat absolutely has health impacts. There are these 3 other areas. They mentioned well-being, but by which I think they meant mental well-being, the sort of stress that's associated with the impacts of climate change. They mentioned community because there are potential impacts on social cohesion, and that's social network, social cohesion, really important impacts on health. And if people are being displaced, for example, because of climate change, well, that has impacts on health as well. And then they had this heading of disease, which I mean, this is all sort of disease here, really, that we're talking about. But by this they meant things like mosquito-borne diseases, because we're at risk of having diseases spread by mosquitoes that are not currently present in New Zealand, but that could be in future. Things like dengue fever. Um, So I said before that World Health Organization had suggested maybe 250,000 deaths per year could happen during that sort of medium term period, 2030 to 2050, um, and um, and that was based on the best evidence at the time. But there's some I suppose there's a number of reasons to believe that the true impacts could be greater than that. And I think was a really interesting piece of research that looked at how many deaths occur, not just in the short term, but in the long term from extreme weather events, from storms. So this was looking at deaths from tropical cyclones in the United States, not just immediately, but over 15 years. And it found that most of the deaths that were caused by them were not the direct effects, they were indirect, things like heart disease. So if you look at the official death toll for a cyclone in the US, it averaged out at being 24 deaths. But they found that there could be 7,000 to 11,000 deaths per cyclone. So there were
Jesus Christ.
huge impacts
What?
on health and
What?
deaths.
The
Um,
ultimate effect of a cyclone in the US is not that.
oh, sorry, someone's not muted there. Someone's not muted there. Um, so yeah, the
Not what?
James, would you be able to mute your microphone, please? So yeah, more deaths than probably are currently being estimated, and of course this will continue to be refined over time. Part of what we can do about that in the health sector, of course, is adapt and prepare. And so, again, I'm not going to speak a huge amount about this, but that's certainly an important health sector role. And one example that's covered in our Health National Adaptation Plan is around that issue of diseases like dengue that are mosquito-borne and not currently present in New Zealand. And as the climate warms in New Zealand, the conditions will become more favorable for mosquitoes, and there's a higher risk that these mosquitoes could become established. So we're already doing this sort of work, but it's going to become harder, I guess, to make sure that these mosquitoes don't become established. So just one example of the sort of adaptation work that the health sector is involved in and will need to be even more involved in the future. Okay, so I mentioned before that idea of opportunities for health, and the sort of term that's often used to talk about that is health co-benefits, win-win kind of solutions for climate change. And so that can relate both to mitigation, broadly measures to reduce emissions, and also to adaptation, which is protecting people against the impacts of climate change. So, mitigation measures can reduce emissions, and that helps to reduce the health impacts from climate change, right? Because less climate change means less of the health impacts from climate change. But there can be this other pathway as well. So if, for example, we got people driving a bit less and walking and cycling a bit more for trips, then that would reduce emissions, which is great. But it would also mean that people were getting more physical activity, and that would improve health through a completely separate pathway. And so that's a kind of example of a win-win kind of an outcome, something that's a health co-benefit of mitigation. And there can be health co-benefits from adaptation as well. We can plant more trees to reduce the protect people from heat stress during particularly uh, when the temperatures are particularly high, and that might have a range of other health benefits as well. But most of the opportunities, and certainly the area that I've been working in, is around the health co-benefits of mitigation. So I'm going to spend a bit of time talking about that in a moment. You probably know this, but this is where our emissions come from, and this informs where the kind of most promising strategies are. Where we should be focusing our attention for reducing emissions. So half of our emissions approximately from agriculture, transport the next biggest sector, and between 23 and 24 we've made no dent at all in emissions basically. So not making a lot of progress here. Some of those emissions are from healthcare, so this is another connection to health. About 5% globally of emissions are related to healthcare, so that's a part that health can play, I guess, in responding to climate change. Most of it's hospitals, some of it's pharmaceuticals, and there's a range of other things as well. And this, I just want to mention this sort of framework, which again, many of you will have heard of, I expect, the donut model. Because I find it really useful when thinking about that connection between health and climate change. Donuts, of course, delicious, but not necessarily that good for health. This maybe is an exception. So One of the nice things this does is it represents the planetary boundaries, not just climate change, but the other planetary boundaries that we really need to be thinking about, and staying within, making sure that we don't transgress those boundaries, but also that this idea of a social foundation. And part of that social foundation is it's about making sure that we have health and well-being for everyone. Providing healthcare is one of those important social goals, and we need to expend some of the resources on our planet to do that, but not too many. So we need to think carefully about where those resources go. And partly that's towards healthcare, but actually a whole lot of the other things in the center of this diagram are also important for health, not just healthcare, but you can see a range of other things that are obviously important for health too. And one of the other things I like about this framework is it shows what a problem extreme wealth is, that if some people are overshooting using a huge amount of resources relative to the average person, that just means less resources available for the rest of us, right? And makes it even harder to make sure that we're achieving that social foundation for everyone, making sure that everyone has enough. So then it's a problem if some people have far too much. Okay, so this is what I said I was going to focus on, this idea of win-wins from to do with health and climate, health co-benefits of climate mitigation. And here's an obvious one. I mean, agriculture is our biggest source of emissions, so it makes sense that we need to reduce emissions relating to food. And the good news from a health point of view is there are all of these health reasons to be doing this too. So this I thought was a really useful article looking at the implications of plant, looking at I guess the environmental impacts of plant-based food compared to getting protein from animal sources. And yeah, the emissions from animal sources many times higher than the emissions from plant-based foods. So much bigger impacts on climate change, also much bigger consumption of land, use of land, so less efficient land use from animal-based foods, and animal-based foods also causing much more water use, which obviously we're very familiar with, the water pollution that we have from dairy here in New Zealand. So this is, there are a number of studies looking at this, but this was a really good one, I thought. So what does that mean for health? Well, fortunately, we've got this really good analysis, I think, from colleagues at the University of Otago, and they looked at the impacts of plant-based foods on emissions and also on health. What would happen if we could shift towards more plant-based foods? One of the interesting things they did was there's a lot on this slide, so apologies for that, but they've got this bar on the left here, which is the current New Zealand diet and looking at its climate impact. And if we shifted from there to the next bar along, which is if everyone met our current dietary guidelines, well, that would improve health. And it would also actually reduce emissions a bit. Not by a huge amount, but it would reduce emissions, so that's good. But one of the really interesting things that they found was that if they could shift people to a vegan diet, that would not only reduce emissions by 33%, so a big impact, a big reduction in food-related emissions, but also the health gains would be much better than if people just stuck to what supposedly our dietary guidelines. So our dietary guidelines are not really based on what's optimal for health. They're obviously influenced by other things, such as what people are comfortable with and familiar with, and those sorts of things. Because we know that I show this slide to medical students and say, okay, so who's going to, you've seen this now, becoming vegan it's the best thing for your health, it's the best thing for the climate. Who's going to become vegan? And no one puts up their hand because it's really hard to change. So the good news is that even just shifting from small changes can actually make really important differences still. So just having one weekly additional plant-based meal can reduce emissions by 7%. So that's a worthwhile gain, and that's the sort of idea behind things like meat-free Mondays, for example. That these are the kind of things that are a bit more achievable, feel more achievable to people. One of the things that's really important about these health co-benefits, these health win-wins, is that they have these important climate impacts, so that's good. But the climate impacts are for everyone, right? They're for the whole planet. The health impacts are for New Zealanders. So, I mean, it's not that New Zealanders are more important, but politically, this is important. That if we want our government to take action, and they're saying, well, why do we have to contribute to this global effort? If we point to the health impacts, we can say, well, then no, these are health impacts that are for New Zealanders. And so if that's the case, then it's potentially gets more attention. So that's I think a useful aspect of these health win-wins from reducing emissions. I mean, it's not going to be quick, I don't think. It's not easy to change the way that people eat. People they know what they like when it comes to food. And I don't think the problem is that the plant-based food isn't good. I think it is good, but it's a difficult thing to get used to. And the Eat Lancet project was quite a nice one in terms of defining what a planetary health diet might look like. They actually included some animal-based products in their planetary health diet. Maybe that's debatable, but broadly speaking, I think this was a really good project. And they estimated that if we could get a widespread shift to take up this planetary health diet, this is the sort of thing we like to do in public health, is we have these thought experiments about what if we could get everyone to eat this way. We could have 15 million fewer deaths per year globally, as well as reducing agriculture-related emissions by almost 2/3. So remember that figure I had before, smoking causes about 7 million deaths per year. So we need to do this anyway for climate change. And we could also prevent, double the number of deaths that we could prevent from getting rid of smoking. So this is a huge benefit, and even bigger than just those preventing the health impacts of climate change as well. So another reason to think about these kind of win-wins. And if we're shifting to plant-based food, I mentioned before that uses much less land. So of course we can do, what do we do with that land? Well, one thing we could do would be real rewilding, doing all sorts of things here in Aotearoa that would be good for our biodiversity and good for our native forests. So that's food. Here's another example, housing. So a lot of our emissions are from energy generation. We have, of course, we have lots of renewable energy, but we don't have only renewable energy. So home heating is an important part of reducing emissions. And if people are in well-insulated houses that are warm, they not only use less energy and cause less emissions, but they are in a situation where they don't have to choose between heating their home and feeding their kids. So this image here I really love, because it takes this passive house concept, which comes, I think, from Germany originally, and I think has been talked about a bit as being some fancy German thing that's a nice idea but really expensive. But no, here's Kāinga Ora building these passive houses, and so this is, absolutely a win-win. It reduces costs for people living in these houses, improves people's health, reduces emissions, and again, these benefits, the benefits from this are local and immediate. So that makes them, I think, that gives them a political advantage. Compact cities, another important way to reduce emissions. And I put this photo up here because it's one of my favorite sets of apartments. I think they look amazing. This is on Dawley Street in Wynyard Quarter. But it's hard to change people's attitudes. New Zealanders, I don't think, are very used to living in to the idea of living in apartments. I think this is an example of how great apartments can be. People in loads of other countries already know that, but New Zealanders still require a bit more convincing, but we're gradually getting there. Why is this important? Well, compact cities where we're building up rather than building out. They've done analyses around the world to show how that can reduce the number of kilometres travelled by private vehicles and increase the amount of public transport and active transport. It just makes it easier to do what you need to do by public transport or walking and cycling without needing to get in a car. So less car use, less emissions. And that's important for health as well. So this is the area that I do a lot of my work in the connection between transport and health. And these are three of the sort of key impacts that transport can have on health. That walking and cycling is a way to build physical activity into your just everyday life. You don't need to think about going to the gym or affording a gym membership or anything like that. You walk or cycle to the shops or to work or wherever you're going, and you've got your exercise without even need to think about it. It's free and it doesn't take any. It's not something that you need to find a special place in your day for. Vehicle crashes, of course, all of our road toll is due to the transport sector. So if we can have a transport system that is we can change our transport system to make it less car dependent, and that will also reduce our road toll. And I'll talk about air pollution as well in a moment. And again, all of these benefits from a health perspective are for New Zealanders or for Aucklanders if we do it at a city level. So local and immediate. So that can appeal to council, it can appeal to government. There's a whole range of other impacts as well, which we still have a bit more to learn about, but we know they're important. But here's the equality, which I said I would talk about. This is from a study published a few years back called Happens that showed that over 3,000 deaths per year are caused by air pollution in New Zealand, and this is air pollution that's caused by humans, and most of that is from motor vehicles. It's from transport. So this means that we've got this huge opportunity, if we can reduce our dependence on cars, to not only reduce emissions, but also to clean up our air. And this is really not well known, I don't think. So here's another tobacco comparison. Tobacco kills maybe 5,000 people in New Zealand each year. And this is a bit less at 3,000, but we take smoking really seriously. We don't take air pollution anywhere near as seriously. So this is an area that needs a lot more attention, and it's absolutely something that's very relevant to our climate response. So what do we do about this in the transport sector? Can we fix this using electric vehicles? There's lots of good things about electric vehicles. You might have seen a slide like this before. This is what our city, so I'm here based in Auckland, Tamaki Makaurau. This is what the city looks like before electric vehicles. Electric vehicles, you're not burning fossil fuels in the car, but there's a whole range of other problems that electric vehicles just don't solve at all, including, roads clogged with traffic. So if we shifted everyone from fossil fuel cars into electric cars, what would that do? Well, it would reduce emissions. It wouldn't reduce emissions to zero because there are emissions involved in the manufacture and the sort of life cycle of electric vehicles, but it would reduce emissions. So I think that makes EVs an important part of the picture. It doesn't do anything to sort of car-dependent sprawling cities, doesn't help with that at all. Doesn't help people get more exercise, doesn't help keep our roads safer. There are some improvements to air quality, but actually even electric vehicles still produce pollution. It's not from the tailpipe, but it's from brake and tyre wear. So it doesn't completely solve that problem either. And there's this big equity issue, right? So electric vehicles are more expensive to buy. So if we do get some air quality benefits, that's likely to be in the neighbourhoods where people live who can afford these more expensive cars at the moment. So an important part of the picture, but certainly not the main part of what we should be doing with our transport system. Here's what I think we should be doing with our transport system. This is, I think we should be thinking about not just electric cars. I think we should be thinking about less cars. I love this picture. This is an artist's impression of Quay Street. You can see the top right little inset there about what Quay Street used to look like. Very car dominated, 5 lanes of traffic, lots of tar seal, and then. Okay, this is an artist's impression, but this is a much better ratio of cars to people, I think. This is what we want our cities to look like. And I don't know if anyone's had the opportunity to go down and visit Quay Street recently, but I think it's looking amazing. It's a huge improvement, and that's about making it a less car-dominated place, making it a place for people, not for cars. So that's, I think, much more the way forward than just thinking about switching to electric vehicles. Here's a project that I was involved in, again, trying to sort of improve that balance between car use and sort of neighbourhoods for cars rather than for people and for walking and cycling. This was a project in Mangere, which was aiming to do some changes to the street design to reflect cultural identity and make the neighbourhood safer and easier to get around, especially by walking and cycling. So there are initiatives going on to try and improve the city and shift the city in this direction. And I'll just mention this as well, which is a piece of work I did when I was doing my PhD, which was this issue of cost. And this is, I guess, relevant at the moment because congestion charging is becoming a bigger thing. We're preparing for congestion charging. Looks like it's going to happen. Nothing's completely set in stone yet. And so the work that I did was looking at how changes in cost would affect greenhouse gas emissions from transport, how it would affect health. I'm just focusing on these three health effects that I mentioned before around physical activity, crashes, and air pollution, and how it would affect equity. How would the benefits and costs be distributed between high and low income groups in this case? Just focusing on Auckland. And so what I found was that I looked at a couple of different policies. What if we made public transport free? And what if we made it more expensive to drive? So this wasn't congestion charging. It was distance-based pricing. And it essentially meant a thought experiment. What if we charged everyone 50 cents per kilometre to drive anywhere in Auckland? Pretty, a deliberately sort of radical scenario, I guess. The effects of free public transport, well, it was good for emissions. It reduced emissions by 2 or 3%. It's important. It doesn't exactly fix the problem, does it? But it's still an important contributor. It also improved health, and it improved health the most for people who are on lower incomes. So seemed to be a health gain and an equity gain as well. And the other important thing, which I wasn't able to, this was not part of my health modelling, but clearly it's going to reduce the costs for people who are trying to get around because public transport's free. So that's free public transport. What about distance-based pricing? What if we made it really expensive to drive a car? What would that do to emissions and to health? Well, that had a much bigger impact on transport emissions, 30% reduction. And that's, a really significant reduction, right? That gets us, it doesn't get us all the way to where we need to go, but it would be a huge step. It would also improve health much more than free public transport. And again, especially those health outcomes would improve most for people on lower incomes. But of course, there's a really big a but associated with this, isn't there? A really big increase in costs for people traveling. So, useful to think about what the benefits might be for health and what the benefits might be for emissions, but not something we could really realistically do unless we could address this issue around how expensive it would be for people traveling. So is there a way to deal with that? Well, I actually think there is a way to deal with costs. And I was really interested to find out about this scheme from Canada, their carbon pricing system. Now, I don't know a huge amount about it aside from what had been the information that the government sort of provided publicly on their websites. But the general plan behind this kind of scheme is, making polluting activities like driving a car more expensive. A bit like in that scenario I was just talking about, making it more expensive to drive. And then you collect a whole lot of revenue, and then what the government did is it gave it back to families. So the revenues returned to families, and what that meant as well was that 80% of families were getting more money back than they had to pay out. And that's because the people who do the most travel and who cause the most pollution tend to be the wealthiest. So especially low and middle income middle income families who were really benefiting from this scheme. They were getting more money back than they had to pay out. So it seemed to be much more of a win-win, and the sort of thing I think you'd need to do if you were going to have big increases in the cost of driving a car, cost of polluting activities, which might be the sort of thing that we would need to do if we wanted to get some really rapid change. So yeah, this is a sort of a carbon dividend sort of an approach, a bit like universal basic income, I suppose, but tied to climate change. And of course, the problem is this was removed in last year by Mark Carney, the new Prime Minister. So even when there are good examples of solutions around the world, it doesn't mean that they're going to last necessarily. We shouldn't take them for granted. But still, this was showing a way forward. It was showing something that we could do to change people's behaviours without punitive costs for low and middle income families, which I think is a really important consideration. So my kind of perspective on that connection between health and climate change is that we've got all these opportunities. We can have healthier diets that are also better for climate. We can have healthier transport systems that are also better for climate and make more livable cities. And better housing. Why are we not just doing this stuff? I think that's a really interesting question. And, we absolutely aren't. We're going backwards currently in a whole range of areas, and this is just one of the more recent examples that we're changing our climate law to prevent lawsuits against major companies to hold them responsible for their emissions. So I think this is a really important question. Why are we not doing more? And so I think one of the key messages from a health perspective is not that we don't know what to do. We need to work out what to do. We need more research on what to do, and then once we've got really strong research, then it will happen. We've got strong research already. We've got all of these opportunities. We know enough about them to take action, and yet we're not doing it. If anything, we're going backwards in a number of important areas. So I think that's a really important area of focus for the connection between health and climate change, but just for climate in general. And this is sort of the health perspective on related to some of this. We're starting to think more in health about the side, we call it the commercial determinants of health, but basically corporate influences on health. And this is not completely new to health, because a long time ago, we realized that the tobacco industry was having, having huge impacts on people's health, and that we needed to do something about that. What we haven't managed to do is to successfully expand that to other industries. So this is one way of representing that, I suppose, that we need all these actions predominantly from government. And yes, the public can help to lobby governments for that, to call for that, to advocate. But industry is playing a role as well. and industry's interest is in profit, and that's often opposed to what's good for climate and what's good for health. And I would say that the two of the key barriers to this, two of the key reasons behind this this issue of why are we not doing more. I mean, partly it is about public attitudes. It's about social norms. These are the hard things to change. There's a bit of inertia, and this is probably I don't have all the solutions to that, but I think groups that in NGOs such as our climate declaration have an important part to play here in showing leadership and in bringing people together and starting to change attitudes and norms. But absolutely, I think industry practices are incredibly important, and I think we really need to address that if we're going to make progress on reducing emissions and on realizing some of those health benefits that would go along with that as well. So I guess my job is partly to convince my health colleagues, or more of my health colleagues, a lot are already on board, that this is the case. I just heard about this concept that George Monbiot came up with relatively recently, or maybe I was reminded of it and I'd heard it before. This idea of the pollution paradox, that the more polluting a company is, the more it has to spend on politics, the things like lobbying, to make sure it doesn't get regulated out of existence. So, and you can sort of look at that from a health perspective as well. So the more the health benefits would be from taking these actions, the more industry is going to have to spend on lobbying government to make sure that that regulation doesn't happen, to prevent those benefits from happening. We should expect. I mean, I've talked about how enormous some of the health benefits are. 15 million deaths per year that we could prevent around the world from healthier, more plant-based diets. We should expect the industry to be spending enormous amounts of money to prevent that, to prevent regulation that makes that a reality. Okay, so I guess I'm making the case that companies have a really important impact on the sorts of actions that we need to address climate change and to improve health. So how do we do here in Aotearoa? I mean, we know that one thing I think a lot of New Zealanders know about is the Transparency International Index, the Corruptions Perception Index, I think it's called, and we've always ranked near the top for that, right? So that suggests we're a really kind of transparent, non-corrupt kind of a country, right? We have slipped down the rankings a little bit in the last few years. But we're still, I think we're placed fourth at the moment, so we're not doing badly. So how well do we regulate lobbying? How do we compare to other OECD countries, for example? You'd expect we're doing pretty well, right? We're doing terribly. I mean, this is from an OECD report looking at how well we regulate to prevent inappropriate lobbying from corporations in New Zealand compared to other OECD countries. We came last. 6 is the worst you could get on this scale, and we were almost at 6. We're doing almost nothing. So I think this is something that we don't. It doesn't get talked about that much, does it? I mean, some people are talking about it, but I don't think it's particularly it strongly comes through in the public consciousness. I think we've got a lot of work to do here, and if we don't address this, I think it's going to be very hard to get any of these things to happen that we need to happen, because corporations are going to fight back and lobby to stop them from happening, and there's nothing stopping them from doing that because we don't have the regulations that we need to control lobbying. So a lot of work to do there, I think. And this is another area where I think health can provide some useful experience and information. I'm not sure how many people would have heard of this, the World Health Organization Framework Convention on Tobacco Control, really important international public health treaty. And one of the things that I mean, tobacco has been a huge success in New Zealand. We've reduced smoking rates hugely in New Zealand. We've been a world leader despite recent backward steps. And it's really been very successful, even though there's more work to do. We're not a world leader when it comes to climate action, but we have been with tobacco. So this is a good thing we could learn from, I think. And the Framework Convention on Tobacco Control had this really important article, I think, relating to corporate influence. It said that parties, the countries, shall act to protect tobacco policies from commercial and other vested interests of the tobacco industry in accordance with national law. And countries around the world are doing this. And it's not perfect. It's not perfectly implemented, but there's been a lot of work done to protect governments from the interests of the tobacco industry. We're not doing this when it comes to climate policy, and I think there's a whole lot more that we need to do there. That's not something I'm an expert in, but I think it's not getting the attention that it needs, and maybe this is something that we could learn from. The other thing that I think I find really important, just in terms of what we in the public can do to in that context where there's industry that's lobbying government and industry seems so powerful, how can people have an impact on that? Well, of course, we can do that by organising into groups like our climate declaration, and then these groups can organise as well and form coalitions. And I've seen these coalitions being really powerful in the past. This was an example related to that sort of area of transport, trying to get the council to deliver some street improvements that would improve travel by cycling and by walking and by public transport, and this was ultimately successful, and it involved all of these groups getting on the same page, including on here is the Auckland Regional Public Health Service, which is part of Te Whatu Ora Health New Zealand. So health sector involved here. This is a coalition that I'm involved in called Healthy Auckland Together. It's a very health-focused coalition. The goal is to improve food environments and conditions for physical activity. And we have over 20 partner organisations. When we talk about improving conditions for physical activity, one of the things that we're doing is focusing on healthy transport. And healthy transport is also climate-friendly transport. So this area we've been working on recently is around air quality. What can we do that's going to change our transport system? Here in Tāmaki Makaurau, we've been focusing in a way that's going to be good for health and generally in a way that's good for climate as well. And it's been really powerful to have that coalition and so many different partners working together towards this goal. I can't have a presentation about climate and health without talking about OraTaiao, the Aotearoa New Zealand Climate and Health Council. It's been around for, I don't know, over 15 years now, I think. Yeah, a really important NGO. It's had some really important wins in terms of improving in terms of climate action. And so I suppose this is a potential partner for our climate declaration, isn't it? And I know there are connections there. So this was the sort of thing that OraTaiao did to support its members. So what can health professionals do to help address climate change? I thought they framed this really well. They said, yes, there are some personal things that people can do at an individual level. They can try and engage with the health system as well to reduce the emissions related to the health system. But most importantly, they can engage politically. And that's the sort of thing that an NGO can do, supporting climate and health groups, engaging with the policy process through submissions and other means. So those are the sorts of things that health professionals can do. That's the role for health professionals in the climate response. My topic has been around where health in general fits in the climate response. And so I think these are the kind of points that I've tried to make as to why health is important here. One is it's an important source of emissions, the healthcare sector. Another is that a lot of the adaptation we need to do, health plays an important role in that. I think these health co-benefits are really big. And so that means they're a really important part of the case for why we need to reduce emissions, why we need to take these actions. And even when the emissions benefits are sort of global and we don't see immediate returns, a lot of the health benefits are much more immediate and much more local, which can make them more appealing for people or governments who are thinking immediate and thinking local. The health sector can be part of coalitions, and I think this Framework Convention on Tobacco Control is a useful precedent. It's not exactly a blueprint, but I think it gives us some pointers about some of the things that we might be able to do to tackle corporate influence, which I think has to be an important part of the solution. We're not doing enough there. So this is, I guess, my vision from a health point of view. This is where that this ought to be a good news story, that we can have climate action that gives us health co-benefits. That's just not going to just make our climate healthy. It's also going to give us cleaner air, cleaner rivers, healthier native forests. It's going to give us healthier diets and healthier homes. Make it easier to do more healthy and active transport, make our cities more livable, and ultimately make our people healthier and give us a more just and equitable society. So, yeah, what's not to like, really? Kia ora, that's it from me. So I'm very happy to to hear questions and comments. I'll hand back over to Sue, I guess, about the best way to do that.
Thank you very much for such an informative and interesting presentation. Now, I'm just looking for anyone for their hand. Oh, here's a hand up, Paul. Go with Paul to start with. Paul?
Well, yes, thanks. I just wanted to say that some of the impacts of increasing fuel costs may make the extreme temperatures that will be happening in the coming year may make much worse and high amounts of fatalities here, especially in India, where people won't be able to afford air conditioning. They that will have a real impact. What's your thoughts on that?
Yeah, thanks, Paul. I was struggling to hear a little bit, but I think you're talking about the impact of costs on people, right? And including fuel costs and maybe, I mean, there's all sorts of costs here that are relevant, right? Heating costs as well. It's hard to imagine that a lot of these costs are not going to go up. I think that has to be a really important part of our response, that we need to be thinking about how people are going to be able to afford these things and how to meet basic needs. And so I think that's why I think it's really promising, these ideas of a climate dividend or a universal basic income approach, or something that combines those to make sure that and so there are some benefits to costs going up. That doesn't mean it's a good thing, because it causes a lot of pain for people, right? But the benefits are that when costs go up, people use less of that thing. That's the sort of the economic perspective. So I guess ideally what we would like is to have the benefits of that, but without the pain that goes along with it, right? And so, yeah, I think we absolutely, I don't think we can prevent costs going up for these sorts of things. So I think we need to make sure that people have people are, they can get what they have they can get what they need most, that people have enough of what they need to live a good life.
Great, thank you. Okay, Joe.
Oh, thank you. Jamie, thanks. That was great. And I was very shocked by the figures on regulating lobbying in New Zealand. My question is, there seem to be quite a lot of organisations, including my own Nelson Tasman Climate Forum, working on active transport and the health co-benefits, but not a lot of activity on dietary change. And I wonder if you have any thoughts about why that seems much harder to talk about, much more difficult for organisations to endorse and act on. Any thoughts about where we might go on bringing about a change of diet?
Yeah, seems like a really good point. And it's great that there are lots of organizations pushing active transport. Um, I don't think we're really winning. I'm involved in this as well, and we've still got a long way to go. Here in Auckland, I mentioned that project called Te Aroha Future Streets in Mangere, and we thought we would do some, as part of our research, try and look at whether we could increase the number of people who are walking and cycling in this neighbourhood, and we looked at that and using another neighbourhood as a comparison where they didn't have any street changes yet and didn't have any neighbourhood improvements yet, and their walking and cycling was going down in the other neighbourhood where nothing was being done, and things are getting worse. So, that's yes, I think the comparison is not that we're seeing these great successes with promoting walking and cycling, but we are seeing some. We are achieving some things.
Great, thanks, Jamie. Richard.
No, he hasn't answered the question.
Can I talk about food for a moment?
Oh, sorry.
Richard,
but
yes. I agree that we're doing worse when it comes to food. And again, my perspective on it is that it's about norms and social norms and attitudes, that these are very hard things to change, especially when it comes to food. Food is so tied up in our everyday lives and our identity and our culture and all sorts of things. And it's so hard to eat differently from the way everyone else eats. That's a really hard thing to change. But then there's the corporate influence. And, it's very hard to point to sort of direct impacts. But we have Fonterra in this country. It's so powerful. We see that, reflected all the time in the sorts of things the government says at field days. And, I think we need a lot more work to tease that out. And I think that's why we need those regulations against lobbying to protect policy from those big corporate interests who absolutely are trying to do what they can to increase their profits, because that's what corporations do.
Okay, Richard.
Thank you, Jamie. That was very interesting and comprehensive. I've got just one question and one comment. With regard to the carbon intensity of beef, was that grain-fed or grass-fed in your diagram?
Oh, I couldn't tell you that, Richard, but if you get the slides, you'd be able to go to the URL. I'm sure there are some differences there, but the difference was so great that this is kind of orders of magnitude difference between plant-based food and beef. So you could look at either of those, and I'm sure that the impact would be the emissions would be much greater either way. But yes, it may, of course, that's an important consideration.
Because our farmers here will claim that because we're grass-fed, we're doing much less damage than the US, where that graph probably came from. Just a comment on that. And just a comment on electric vehicles. I know this is often controversial stuff. Electric vehicles have embodied carbon, which is higher than the equivalent sized car, which is petrol-driven or petrol or diesel. But after a couple of years, the benefits greatly outweigh those carbon costs. And over the life cycle of the car, it's a lot better than a petrol or diesel car. And the maintenance costs are much lower, and the emissions are almost zero, of course. One comment on your brakes and your tyres. The brake dust is actually lower because the brakes are not used so much because of regenerative braking, but the tyre dust is higher because it's a heavier car because of the battery. Just a comment there. Oh, also, distance pricing. We've already got that, haven't we, with the road user charges? Just need to improve on the system.
We have road user charges on electric vehicles, in fact.
All vehicles, yeah.
Yeah, well, and electric vehicles and diesel vehicles, but yes, that is exactly a form of distance-based pricing.
Okay, thank you. So it's MRNNHNZ. I haven't got a name.
Hello,
Got
it's me, Marcus.
Okay.
Yeah, thanks for the presentation. That was very interesting. The one thing I noticed in the presentation how there was some big benefits to be made from changes to a vegan diet, like you were mentioning. I wonder if any work had been done comparing with, say, a vegetarian diet, which it might not be quite as good, but is potentially a lot more approachable for some people. I would consider going to a vegetarian diet several days a week, but I don't think I'd be able to approach getting to a vegan diet. It would be just too much of a mountain to climb.
Yeah. Look, my general understanding from a health point of view is that that a vegetarian diet, the sort of the health risk is, as you'd expect, somewhere in between a vegan diet and the sort of, say, the standard New Zealand diet. So yes, a lot of the benefits, but probably I don't think this is completely settled yet either, but probably even more benefits from going vegan. But I think that point that you make is really important about what's manageable for people, and just telling everyone to become vegan. I think some people will, great, but other people will just find that really, really hard. And so changing a smaller part at a time is an important part of the approach. Maybe that's becoming vegetarian instead of vegan, or maybe it's just having one extra plant-based meal per week. So yeah, I think it's really important to think about what's achievable.
Thank you. Okay, Tim.
Kia ora. Thank you, Jamie. That was a really interesting presentation. I'm the president of Living Streets Aotearoa, which is a national walking advocacy organisation. So I was very pleased to see our logo on one of your slides. But my question relates to that, and obviously to do with transport. My experience is one of the problems is siloing within government departments. So when we want to talk to transport officials about the health co-benefits, they say, go and talk to the health people. And when we want to go and talk to the health people about the relationship between transport and health, they say, go and tell that to the transport people. In your experience, have you found ways around that siloing particularly when it comes to budgets?
Yeah, thanks, Tim. And that's that absolutely is a really important issue. And from within the health sector, I still see that a lot. That not everyone sees things this way, but a lot of people think, well, transport, walking, and cycling, that's not our problem. There was a plan recently to redevelop Green Lane West, which is a major road and an area where there's a big gap in Auckland's cycling network, and it was being redeveloped, and big changes made to the street design, and there was no improvement to cycling. And this was right outside the Green Lane Clinical Centre, but it took a little bit of talking, I understand, to the people at Green Lane to convince them this was a health issue. The Green Lane Clinical Centre ought to be advocating for cycleways to be part of this plan. So yeah, I think siloing is definitely going on. In terms of the solution, the thing that's been most useful in my experience has been coalitions. That I mentioned that group before, Healthy Auckland Together. It's just been so valuable for us. We've had representatives from lots of different agencies. We have health people, we have people from Auckland Transport, we have people from Auckland Council. Not everyone in those agencies are necessarily on board with the sorts of things that we're trying to achieve, but some are. And so it's been a case of finding those people and then hearing from them about where we can where we can make these connections. Or if they're telling us, look, there's these street changes happening outside this hospital. Why is the hospital not saying something about it? Then that's when we can take action at our end. That's the best thing I can come up with, I think.
You're muted, Sue. I think you wanted to give Steve the floor, did you?
Stephen.
Kia ora, Jamie. Thank you so much for that really articulate talk. I'm the transport working group lead at OraTaiao, so I was also really grateful for your shout out to us in one of your slides. I guess my question was, obviously, we've got an election coming up this year, and I was wondering whether our climate declaration have got much work in the pipeline related to the election and putting pressure on parties, or if you're aware of anyone else who's doing really good work promoting climate and health coming up to the election that people can get involved with.
Well, I think that's going to be a question for our climate declaration rather than for me generally. But in terms of in terms of organisations I'm aware of, probably the most relevant one I'm involved in is this group called Healthy Auckland Together, and we I guess we recognise the importance of politics, but we try and stay out of it because it's not really, although it's important, it's we're trying to be based on, I suppose, evidence rather than politics and so on. We want to try and our focus is more at a city level. So we didn't make any attempts to influence the local government elections, but we did try to say before those elections, well, here's what we think some of the priorities ought to be for the city. So I can't give you too much information there, but I would say that sounds like a great connection to make potentially if there is something that our climate declaration is doing there. So I'll hand over to Sue or to someone else from our climate declaration.
And yes, we do have a program that we're working on in terms of the election. Does anyone else want to comment on that? Speaking to politicians and so on. Anyone else want to further that? But that's about all at this stage. Okay, Joe. Oh, you're muted. Okay, I can't hear you.
Helen is was first, Sue.
Oh, sorry, Helen.
You're muted, Helen. You need to unmute yourself.
Thank you. Joe mentioned early on about the vegetarian diet, and you know, I've been vegetarian for 40-something years, and well, lately I've decided that I will eat hunted meat. You know, it's not good to leave it lying in the forest to feed vermin. So I've made that concession over later years. But I once asked somebody. Once somebody said to me, "Well, I love my meat," and I said, "And I love my grandchildren." Yeah. So I worked that one out. But I think, you know, one of the things that we're going to have to get used to is a diminishing supply and increasing cost of diesel. And that's going to have an immense effect on food availability and distribution and cost. And you know, it's not going to be many years before diesel becomes a real issue. And I think that's going to encourage more localization, and also a local currency can encourage localization too, where a local currency system can help reduce long supply chains and various other things that contribute to climate change and our general health.
So, but when I just wonder what you think about it, Jamie, about the vegan diet, when very often, if you have a look at what's available on the shelves, the food is imported. And so that's adding to our woes. What do you think about that? Because, you know, I think people should be growing their own backyard gardens, but there are some things, cereals and so on, that we need to buy. And so a vegan diet often has people buying things that are from far, far away.
Well, thank you. Yeah, I think that's an interesting issue around different types of vegan foods. I have a colleague who did a piece of work with a student looking at the cost of a vegan diet in New Zealand, and they looked at two things. They looked at they looked at, I think, climate and health benefits, which were significant from the vegan diet, but then they looked at the cost, and I thought, oh well, that's good because um, most of the vegan food I eat is incredibly cheap. It's things like you buy some dried chickpeas and then you soak them and you cook them, and you end up it's just so cheap to eat that way. And they found that the cost of the vegan diet was higher. And I thought that was fascinating, and I asked why, and it was apparently because the way they'd constructed the diet was to look at supermarkets and look at their vegan products that were substitutes for some kind of meat product. So vegan sausages or vegan burger patties, or those sorts of things. Well, they're probably not good for health either, let alone your wallet. Yeah, so I think it all depends on what sort of vegan food you're eating. It does depend on what's available. It's if you go to a supermarket, it's not easy to find healthy food in a supermarket, and finding vegan food is often really tricky, and that puts people off being vegan. And in terms of the food miles, yep, I mean, localism is a great thing. I'm interested in transport. I think it's great when people can get what they need without needing to get in a car, and food gets transported as well, and there are emissions associated with the transport and food. My understanding from my colleagues is that the transport of food is important, but it's not. It's much less significant than the type of food. So that from their point of view, if you had to choose from a climate point of view between buying local beef and imported chickpeas, then you should go for the imported chickpeas. Yeah, but having said that, yeah, I'm sure if we can do things locally, then we should. And maybe we need to look at what other types of food we can produce in New Zealand. I think we assume that all we can do is produce beef and dairy and those sorts of things. And maybe is a broader range of things that we can produce.
Thank you. Okay, sorry, Helen, do you got a question?
No, I'll put my hand down now. How do I put it?
Okay.
Yeah.
Okay, Jo.
Thank you. Tonight I was thinking about yet another co-benefit. I was reading a paper in Lancet Planetary Health about the mental health of young people concerned with climate change and their feelings of hopelessness and helplessness to change anything. And then I was thinking about the kids that we're seeing in a project that we're doing on the school commute, getting kids to get to school by active or public transport. And these kids are talking about climate change with the other kids in their class, with a knowledgeable adult or two, and then they're designing their own project to improve active transport and getting support in carrying out their project, which they do with huge enthusiasm and sense of efficacy and achievement and a conviction that they can change things, and thinking that this is primary prevention for the mental health impact of climate change on young people.
Yeah, that sounds like a great initiative. And I think you're absolutely right that that seems to be a potential benefit for mental health, because it's the powerlessness often that's particularly awful, isn't it? I mean, if you're a kid and the adults have created this problem and there's nothing you can do as a kid to fix it, what an awful position to be in. So yeah, I think absolutely having kids participate in solutions is really important. One thing that as long as we don't expect kids to do it by themselves.
Yeah.
I've just been involved in a project looking at what kids say it's like to walk to school these days, and we were looking at it before and after the government increased the speed limits around schools, or shortly after the increase, and then after a few months later after that. And kids were saying it's the traffic's dangerous, it's too fast, we can't cross roads, it doesn't feel safe. But I like walking because I get to spend time with my friends and I can have contact with nature and all those sorts of things. But there were people sort of expressing concern about how the kids were involved in things like providing safe crossings, those crossing patrols, and the teacher helpers needed to keep the kids safe while they were doing that, because cars weren't always stopping when it came to when it came to the pedestrian crossings. Kids were telling stories about how they would be walking with younger kids and they knew they needed to keep them safe and keep them off the roads. So that's sort of like putting the responsibility on kids to deal with this problem that they didn't create. I mean, the neighborhood environment is just incredibly dominated by cars. It's really dangerous. It's not safe for kids often. It ought to be much safer for kids to get around independently by themselves. That's what our neighborhoods ought to look like. And yeah, in the context of this government change where they'd increased speeds around schools, it was pretty sad to think that kids were feeling like they needed to take the responsibility to keep other kids safe while they were walking to school.
Great, right. Are there any other questions? I can't see anyone's hand. Oh, Meg, you got a question? Are you there, Meg?
Yes, I am. I was just interested in your distance idea, because from my understanding, it's low-income people that have to travel usually much further than wealthier people who tend to live in the city. So I just wondered how you derived, your conclusions that middle and lower socioeconomic people were better off.
Sorry, Meg, is that for the Canada example, or is that for the
Well, and your suggestion also that you almost need a sort of a stick as much as a carrot.
Yeah, I think we need enough carrots to offset the sticks, hopefully, but to try and get the upsides of price without getting the downsides. You're absolutely right that because property prices are higher in the middle of cities, I'm fortunate enough to live pretty centrally. I can bike to work. And my work is in the central city. If you're traveling across town to a job, that's really hard to do. So the distance is a really big issue, and it's a tricky thing to address. One of the things that our Healthy Auckland Together group has been trying to encourage the council to do when it is putting in place its congestion charging, is to take the money from the congestion charging and invest that in public transport, especially in parts of Auckland that don't currently have good quality, rapid, frequent public transport services. And that's, I suppose, one way of helping to overcome some of those the facts that our public transport system, for example, doesn't serve well people living in more distant parts of the city. But it's just a problem with the sprawling city, isn't it? It's another reason why we need to have compact cities so that people can do things locally as much as possible.
Thanks, Jamie. Helen, do you have a question? You've got your hand up.
Yes. Well, it's just a comment, really. The mention of carrots reminded me of using the arts to get our message across. I'm working with a playwright at the moment, and we're going to have a central theme of Throughtopia. That's a journey towards utopia, which we will never reach, but you know, it's got that theme about it. And so it'll be live theatre, and we are hoping to film it as well and make it more widely available. But I think the arts has got a big part to play in getting our message across. And are you aware of any endeavours in that direction?
I think it plays a really important part of the solution, and I have almost nothing to do with it, I have to say. I have a very uncreative job. So fully support the idea, and I'm sorry I don't have much to add at all.
Okay, so we've got a few minutes left. Meg, do you have another question? Or
yes, I was also going to say that many of us are involved in trying and do, frequently write submissions to government, and there's a feeling these days that it's almost a waste of our time because they're not taken into account, and we know that. I've also been extremely aware of the influence of lobbying in New Zealand, and I think many of us just go, actually the best thing we can do is just do something on our local level, because it's just so difficult to influence government decisions, especially with this government. But I don't even hold out hope with any change of government. The corporate sector is so much controlling what goes on in New Zealand policy-wise. So I don't know what we do. I really don't.
you want to respond to that, Jamie?
Yes, go ahead. Oh, so would I like to respond? I misheard. Yeah, well, look, I think, it's absolutely right that the government is ignoring all sorts of evidence and advice about what to do, and making a lot of decisions that seem to be quite favourable to industry and not in the best interests of our people or our climate. That's absolutely what the sort of pattern that I see happening in a lot of different areas. So what can we do about that? Well, I agree that a change of government isn't going to completely solve the problem, because why would industry only lobby one side of the political spectrum? I think I think there's no value in making submissions and trying to push the government. Hopefully the government at least needs to expend some political capital when it overrides sort of sensible advice. But that's not the only thing we can do. We can act locally, and we can, maybe it's not just climate that needs to be the sort of focus of our advocacy. Maybe we need to make lobbying one of our focuses as well. That we need to lobby the government for better lobbying policies.
But I also asked you about citizens' assemblies. I almost think that that's almost the most effective thing we can be doing, is advocating for citizens' assemblies and Have you looked at that?
I haven't, but I mean, there's lots of great work going on in that space, including some people at Waipapa Taumata Rau, University of Auckland. And I mean, again, it provides good advice to government or to council, and it doesn't address the issue of restraining corporate influence. So I think we need to push on both sides of that.
Great. Okay, we've probably got time for one more question. Kath.
Thank you. I really appreciate the forum and all the work that's gone into your presentation, Jamie. Just on the question of lobbying, there has been quite a pressure to get some limits on lobbying. This government, of course, binned most of that, but there's a civil society group which includes New Zealand Council for Civil Liberties, Transparency International, a number of other groups, and ECO was involved for a while until we got sort of had to retreat and man the barricades for the environment. But I do think that we should try and pick up those threads, and we should also document what they're doing. You're probably like us in that we've just been so under a total sort of deluge of anti-environmental stuff that we have not been able to do a lot of the stuff that we wanted to do. But I think we should all be documenting it and at some stage put it all together. I mean, the very first thing they did was to accommodate the tobacco industry. And, Shane Jones had 2 people from the tobacco industry at his swearing in and all that sort of stuff. It would be really, really important, I think, to document it and to pick up those threads and, put the pressure back on.
Yeah.
Not a question, sorry.
No, I
Thanks.
absolutely agree. And I think in terms of coalitions of organizations, then organizations that are focusing on this issue of government transparency and lobbying and regulating corporations, they need to be part of that coalition.
Great. Well, thank you very much, Jamie, and thanks for staying on to answer questions. That was such an informative, forward-looking presentation, and I really enjoyed all the local information and local initiatives that you talked about. And thanks for everyone for being here and participating. So we'll say good night. Thank you.
Thank you.